BC1030 students. I've put together a quick shot to help you understand patient accounts and data flow. The patient registration process consists of creating a patient account on the hospital's computer system and entering patient information that's obtained during that patient interview. An account and a medical record number are assigned to each patient, either by the computer system itself or by a person entering that information. The account is updated when required to reflect new information or changes in the patient's current information. Financial activity is also entered on the patient's account. The patient care process is very complex as it involves many departments working simultaneously, performing various tasks that are related to patient care services. To achieve high standards of patient care and to maintain the financial stability of the hospital, there has to be an efficient flow of information through that patient care process. Taking a quick look at our screen, we see patient demographics here as entered into the hospital's computer system, the patient's insurance information, and also financials on the patient, how much the patient owes and how much the insurance company owes by how many days it's been out with the insurance company. This one's been out with the insurance company between 0 and 30 days. Let's take a look at how patient account data flows through the hospital and why it is important to the financial stability of the hospital. The flow of information in the hospital includes the patient demographics, the insurance, and the medical information. The flow of data begins when the patient reports to the hospital for a patient care service. The type of data and the flow are going to vary based on the type of service that the patient is requiring. The hospital's health information system allows for the recording, the storage, the processing, and the access of data by various departments simultaneously. Departments that perform specific functions may use the data that was entered by another department. This level of automation enhances the flow and the use. Variations in the flow of information occur based on whether the patient presents for an outpatient service, an ambulatory surgery, or an inpatient service. The flow of data is similar in each scenario. However, there are some variations in the data and its flow. For example, the outpatient and inpatient services will require a physician's order or a physician requisition. But if the patient shows up at the emergency department, an order is not needed to be seen there. Outpatient services are those that are provided to the patient on the same day and the patient is released on the same day. The process of flow will depend on the area that's involved, such as the radiology department. There will be a physician's order that's going to detail what type of radiology service is needed and why that service is needed, such as the diagnosis, the symptom, or the sign. Medical record documentation is critical to the provision of patient care services and for billing patient care services. The HIM department is involved in both areas as it is responsible for the patient's medical record and performs many important functions that are related to reimbursement for the patient care services. The purpose of medical record documentation is to have all the detailed accounting of the patient care activities. Medical record documentation will serve many purposes in the healthcare facility, such as enhancing communication between providers, supporting charges billed, improving utilization review, and providing protection from liability. A hospital cannot maintain financial stability if the cost of providing care is not reimbursed appropriately. From the time a patient is received at the hospital to discharge, services and items are provided. Charge capture is the term commonly used to describe the process of gathering charge information and recording it on the patient's account. The process of capturing charges will begin with the physician's order and is completed when charges are entered on the patient's account. The discharge summary provides an overview of patient care activity during the patient's stay, including the patient's condition at admission, the care that was provided during the course of the hospital stay, and the patient's history and physical status prior to discharge. The admitting physician is the one who dictates that discharge summary after they have performed a detailed history and physical to determine if the patient is actually ready to be discharged. After discharge, the patient's medical record is forwarded to the HIM department for review and coding of clinical information. Once the HIM department has finished coding the chart, the patient financial services will prepare the charges to be submitted to either the insurance company or to the patient. If it's being submitted to the insurance company, they'll use a CMS 1500 claim form or a UB04 claim form. The patient financial department will handle outstanding accounts to ensure they are received in a timely manner. The term used to describe outstanding accounts is accounts receivable. A division of the patient financial services department, credit and collections, is responsible for monitoring outstanding claims to determine accounts that require follow-up. A hospital absolutely cannot maintain financial stability if the cost of providing care is not reimbursed properly. From the time a patient is received at the hospital to discharge, services and items are provided. The complexity of providing patient care services and capturing charges within a hospital setting is going to require efficient systems that can capture all of that data. In addition to data maintenance, security, and management of the medical records, the Health Information Management Department plays a vital role in the reimbursement process. This department is responsible for the maintenance of the charge master. The department also performs periodic reviews of the charge master to ensure that the codes and the various payer edits corresponding to the services and the items are current. Other functions that are performed related to the reimbursement process include reviewing the records. A coding worksheet is often utilized to abstract information regarding the patient's diagnosis or diagnoses and procedures. The coding worksheet is then utilized to input those codes into the computer. Most hospitals utilize a software program called an encoder that will assist personnel with code assignments. Data coded by the HIM department generally include the principal diagnosis, the principal procedure, and the admitting and secondary diagnoses as well. To maintain financial stability, the hospital must have an efficient process for obtaining reimbursement from patients as well as insurance companies. The hospital billing process begins when orders are submitted for patient care, and it ends when that account is paid in full. Automation of registration, order entry, and charge capture process allows for the gathering of data required for billing throughout the patient stay. These data are utilized by the patient's financial services department to perform billing functions, which include the charge submission and the posting of patient transactions. The billing process includes preparation and submission of the claim forms to the third-party payers, preparation and submission of the patient statements, as well as posting patient transactions like payments and adjustments to the accounts. There are two universally accepted claim forms used for submission for charges to various payers: the CMS 1500 claim form and the CMS 1450, also called a UB04. The CMS 1500 is the claim form that's used by non-institutional providers to submit professional charges for physician and outpatient services to payers for reimbursement. The CMS 1450 is the uniform hard copy of the claim form used by institutional providers to submit hospital facility charges for services, procedures, and items to payers for reimbursement. The patient account and data flow is a critical element in the hospital's ability to effectively access and utilize data collected throughout the hospital. Automated systems for registration, Order entry, charge capture, billing, and accounts receivable management enhance the ability of various departmental personnel to access and utilize data simultaneously. Data collected are utilized through the patient care process for admissions, rendering patient care services, and billing for those services. The patient care process from admission to discharge involves capturing and recording information regarding the patient and the care that is provided. Patient information is stored in the hospital's health information system and in the patient's medical record. Services and items provided are recorded in the patient's record and on the patient's account. The coding and billing process begins at discharge. The Health Information Management Department receives the medical record for review, for coding, and the assignment of the DRG or the APCs. The Patient Financial Services Department will prepare the claim forms for submission, and the patient statements are to be sent. The Credit and Collections Department monitors outstanding accounts and works to collect outstanding balances from patients, insurance companies, and government payers. It is critical for coding and billing professionals to have complete and accurate information for billing payers and patients. Thank you, and I hope this quick shot has been helpful to you.